So let's talk about these and increasing frequency, in my opinion, of being a problem or of significance. So calicivirus, I would argue, is the least important. It is the one that is most associated, though, with down the line having oral lesions.
Oh yeah.
So we get these cats that have these mouths. You know, we've had a few cats that have been sent to the dentist that have had all their teeth pulled. They're really young. And when we look in their mouths, their gums are all red and their mouths are just like fire engines. They're screaming at us. For whatever reason, calicivirus is associated with more what we call stomatitis. I can't remember what the stoma opening, so your mouth opening, inflammation of the mouth. So if you've got a cat, so all of these cause upper respiratory, it all blends together. So it's not like we have a cat coming in that's sneezing or with eye lesions and we're like, oh, that's herpes, or oh, that's that. Some of them do have telltale signs, but in general, they're like, oh, they got a virus, it's one of them we vaccinate for. Or, oh, we're giving the vaccine so they don't get these symptoms. But calici will tend to cause oral lesions. It did have, it was interesting because I was just reading this in my little thing that I read, that calici, actually there's so many different strains of it, but one strain that they found, and I believe it was Africa, had 100% mortality rate.
Whoa. Oh gosh.
Yeah, and I'd have to find it in
Well,
here.
that's actually a very smart virus because
Yeah.
if you kill that many, you're not.
And I apologize, I don't see where it is in my little thing here. But it can be one strain of tiger origin in China demonstrated 100% morbidity and mortality in domestic cats. So that strain that you're talking about did go around in the 1990s. In 2000, a highly fatal systemic form was discovered and termed hemorrhagic calicivirus, and it just killed them.
Yeah.
So there are some nasty versions of it, but that also goes back to like with COVID when we talk about it changes. These viruses change. But typically the vaccines, when we develop them, are cross-reactive so that they will protect against the little puny trains and then the ones that, were killing everybody in China.
The hemorrhagic calicivirus, there is a vaccine specifically for that. I read in mine.
Oh, really?
There is a vaccine called Calicivax. It's available just for this form of calicivirus, which is the hemorrhagic one that you just
Huh, I'll have to look and see because I would assume there was cross-reactivity, or I wonder what happened with that strain. Put a note down to just look up hemorrhagic calicivirus and ask that question. Because I'm assuming that we're protecting against it, or it's not in the U.S. because you never hear about it. Like, meaning like it's no longer in the U.S. I don't know anything about that. One thing that I also did learn in general, and this one is the limping one. So if you've got, if you do have some sort of joint pain, this one, limping is another one that's a little bit more specific to this one. The other thing across the board that I read, which I thought was interesting, was that sneezing is actually not considered a great way of transmission because cats lack the necessary tidal volume, meaning they don't have enough force to get aerosolized. So direct contact, yes, but like aerosolized into molecules in the air that you then breathe, no. So contacting it, like landing on something, like if it's a droplet landing on something right in front of you, yes. But then walking around the room and it still being in the air, cats can't aerosolize viruses. And I think I read that for herpes and this as much. But on surfaces as a whole, all of these are not great. As Sherry pointed out, panleukopenia is probably the worst. But also that would go along with parvo. Parvo is extremely hard to kill in the environment also.
Because they're
Yep,
They're the same, under the same window.
Same family.
Because
Yeah.
it sounds similar, like it's like the cat parvo.
Yes, it is the cat parvo for sure.
Yeah.
So moving on, panleukopenia. So we kind of talked about this. Fever and calici, I think the gist of it is all of these are terribly awful if you get them when you're young. But these are before we're seeing these cats. When we're seeing these cats, what they're doing is they're sneezing or they've got inflamed eyes. They're not dying because they're old enough to get through it. But if they're less than 4 weeks old or newborns, they die. We just aren't seeing kittens at that age. Panleukopenia would be the second most common one. Panleukopenia, one of the cool things about it is there are some pretty robust support groups out there for panleuc that I've read about on my VIN sites, like how to save them when they are in that less than 4 weeks. And there's shelters that literally have rooms of just panleuc cats. that they are treating supportively and trying.
Like they do for parvo puppies.
Yes, almost to the point where it's like a moral, ethical debate in some of these strings that I've read. Like, is this right? What's wrong with the cats afterwards? What are we using resources for? But panleukopenia has kind of a cult following in the shelter world for treating these kitties. But the vestibular
So if they make it 5 days, they're likely survive.
yes, so this is the one, so if you're talking about calling cards for these, this one, it is gums and limping. This one, it is the cerebellum, it's the wobbly. And they're called wobblers. And we'll have somebody, if you want to go on YouTube and just Google panleukopenia cat, because it's kind of funny to see. I mean, they're kind of cute cats.
Yeah.
Isn't it?
I can get something like that too, right?
Not
But
Not
this.
because of that.
So what it is your cerebellum is your sense of balance. And so anybody that's had surgery or anything that's wonked with their cerebellum, like they can't, and it's like they'll tremor. So normally, if you've got any sort, and it's an intention tremors, which is what she was saying, you focus on it more and you tremor more. Those are never good. That's like only one part of your brain that causes that, and that's just a bad thing. Unless you're a cat that's had panleukopenia.
Oh.
And
So
it's
any
only
other-
the ones that are in the womb that get that version. If you get it outside of the womb, you get real sick. Like the first area goes to the throat, the lymph nodes in the throat. And then after 2 to 7 days, it gets to the bone marrow where it nukes your bone marrow. And then it attacks the intestines where it just wrecks it.
So what panleukopenia does is it takes and attacks quickly replicating cells. And so quickly replicating cells in your body are your white blood cells. They're constantly being made. So your bone marrow, that's why it attacks there. And your gut, like you shed your gut layer constantly. That's like why all these dogs that come in with vomiting and diarrhea, and I'm like, just give them a day or two and it'll create a whole new layer. We just can't put like, Chinese food down there. Like give them a day for those new cells to grow. It doesn't take them
Is this
long.
the same wobbly?
So, so hold on a second. Let me finish this, and we're gonna have her show you that.
I don't know if it's
So
the right one.
basically, wobbly is the characteristic of this one. Herpes is probably the one that we see most frequently here, and that's because the ongoing, chronic, annoying eye lesions and upper respiratory are what these guys are just totally beleaguered with. I mean, they just can't get over them. There's very classic ulcers that they get in their eyes. What it is that the virus, herpes virus, tends to attack nerve endings, and it attacks the nerve endings and the layers in the cornea. So it causes it's called the dendritic ulcer. It causes a specific type of ulcer in the eye. And so if you see that in a cat, it's pretty classic that they have a herpes virus. The other thing that we often see, and you know who has this? Douglas Joneback. He's got that. We've got a few cats with these. Somebody else I can't think of off the top of my head, but Douglas definitely does. The other classic thing for a lot of these guys is that we get these, they're called chronic snufflers, and it's a syndrome, it's even called chronic snufflers, and that's where these cats, their whole nasal cavity has just kind of been annihilated by the virus, and your nasal cavity is what filters everything. So it can't filter, and it gets all plugged up. I mean, it's like taking the filter out of our thing, and it doesn't work anymore, and then they're getting chronic infections, and they're having goo, and they're sneezing. So we have a couple cats, oh gosh, that lady who lost the cat and then it came back like 15 years later, who gets the hypoallergenic food. Oh my gosh, I can't remember her name. Her cat, if it's in the room, there's like wads of snot around the room. And there is not really a good treatment for that. Really, the treatment when we send them is that they put them under anesthesia, they do a CT scan on them, they flush their sinuses, and then they put medication up in their sinuses, but it does not get better. So those are chronic snufflers. So let's talk about a couple of the specifics this one. All of these, by the way, can hang out. I don't know if Panluke can. Does anyone remember if Panluke went quiet?
I think it's one of those once it's done, you're immune from it.
Yeah, I
like,
think
it doesn't flare up.
Khaleesi and Rhino,
Yeah.
You made it.
Yeah.
both of these stay around.
Yeah.
This one I don't think does. So the thing with lysine,
Yeah.
Once again, we talked about there's not like a anti-Callicity drug or anti-Panleuk or anti-herpes drug, but there are drugs that get in the way of the virus replicating. And so when they're talking about the treatments for herpes, there is, oh my gosh, I'm trying to blank on the name of it again right now. Tencyclovir will sometimes prescribe that to Costco. There is also a couple eye drops that they can use. It doesn't fix it, it just makes it harder for the herpes to replicate quickly. Lysine has been controversial, and I used lysine in the beginning.
I remember we used to have lysine
Yeah.
stuff here.
But then what I was reading is there's no real proof that it works.
Oh,
In fact,
Lysine, like the tube. I'm thinking of Lysol for some reason.
yeah, no. So lysine is a lysine. It's technically
Amino acid.
Thank you. I'm like, what is it? It's not protein. So what it does, and I'll tell you what it does. So arginine, which I think is also an amino acid, but I could be wrong on that. Herpes needs to have arginine. Like it has to use that as fuel. Lysine blocks arginine.
Oh.
So it gets in the way of the fuel for the herpes so that it can't replicate. There's conflicting results on whether it actually works or not. So it doesn't hurt anything, but it's not a for sure helping. So I stopped carrying it. We don't have a lot of cats that are in need of it. And they
Also,
can buy it over the counter.
also this one, it says Fortiflora has been proven
Yes,
effective
yeah.
in reducing the length of.
I thought that was interesting. I didn't know that. So probiotics. There's a lot of things that they're kind of like, these probiotics actually can really help.
And then do you know what this polyprenyl immunostimulant (PI) can boost the cat's immune system? Is that like a nutraceutical?
I think that is actually interferon,
Oh,
but I could be wrong on that. I don't recognize
it
that
says it's a
name.
new treatment.
I don't recognize that one. Put that one, give that name to Tegan for me to look at also. So in the end,
Can I ask you a question
Yeah.
on this? So on mine, when we're like, talking about conjunctivitis, it says it retreats into the neurological structure in the head called the trigeminal ganglion,
yeah.
where the patient's immune system holds its prisoner. Where is that? Where, like, why?
It's in the brain, like it's
Okay.
deep it's in the brain, it's a ganglion, like it's a nerve bundle.
Okay,
And so that's where, when I was saying that herpes, it attacks the nerve in the eye.
okay,
So herpes attacks nerves.
right.
And I would bet if you look for humans, that's a similar scenario.
trigeminal neuralgia.
Yes, yeah. So there's a lot.
Trigeminal, that's what it's called,
Yeah.
trigeminal ganglion.
Yeah.
Good job.
So it goes and hides in the nerve cells. And I feel like in humans that's an issue with herpes also, is when it comes, it affects nerves. The
Okay.
nerves are
Okay.
everywhere, so that's why, I think it can have effects in lots of places because the nerves land in lots of places.
That's why it's called the neurological structure.
So let's come back up here. How often and how important are the vaccines? So right now the protocol, and I gave the text, the formal one, so there are a couple different organizations that put out protocols for vaccination. The Feline Veterinary Medical, I don't remember what this is from. Is this the Feline, who's it from? I think it's from it's AHA, and it was put together by the Feline Board of Practitioners, and it just came out in 2020. The only core vaccinations for cats are these three, and then what other two?
Rabies.
Rabies, and this is new,
Leukemia?
feline leukemia.
We don't normally do that as a core.
No, and that's what we're going to talk about briefly here. So the guidelines came out, and their recommendations are, because cats do not get immunity from mama's milk, they only get it transplacentally, so while they're inside. Dogs get immunity also from the milk. So what happens is they've determined that the immunity for the baby can wear off sooner, and our vaccines can take over sooner. So they feel that a large portion of these cats are not protected by mama anymore by about 4 weeks of age.
Oh.
We don't vaccinate till 6.
Is that why you think so many cats are exposed to it in a shelter? Like, because if you're not vaccinating until 6
Or
weeks,
8 or 10 or 12, possibly. Yeah, they do
when
not.
they're in foster house, they're exposed to all of this already.
Yeah, so that's one of the problems they've come up with. But so basically what they're saying is by the way, these kittens are gonna get it sooner. But then on the flip side, they've also found in a study, one study I believe it was, that 30% of cats did not have effective immunity at 20 weeks of age from vaccination. They still had some immunity left over. So it's like almost like a double whammy on both sides. So the new recommendations are that we give this vaccination every 2 to 3 weeks, starting as early as 6 weeks of age through 16 weeks of age, that we booster it at 6 months,
When they come in first.
and then a year later they get their 3-year actually I take that back. You booster it at 6 months, and that serves as their 3-year vaccine. So I'm like, okay, so that's what we need to do. Like, I can do that. But then I read on VIN, and I'll tell you that a lot of immunologists, like the powers that be there, are like, that's a bunch of bunk, and it messes up our vaccine protocol. I don't know. So I haven't really decided what we're doing. I don't think it hurts to do it at 6 months. I don't know why we wouldn't. But then you have to have them come back in for the rabies. It just gets their schedule off. But I don't know.
Couldn't you just do the rabies then too?
No, you can't. I can't remember why not, but you can. That's a good question.
At the lab sites.
Yeah, why can't you just do the 3
Like
years?
just do it
Oh.
early so they're on the same schedule.
I for some reason that was not given as an option, and I can't. I feel like somebody said why, but I don't remember. But I'll ask that. Ask that actually why we can't give rabies at 6
I
months.
guess you could give it to people as an option, like we could do it at the same time, so on the same schedule, or.
So that's one that we probably will incorporate. I think it's questionable. I think some people really question whether that was a good change that they made.
Because it is only like it's only a couple months then after they get their, so it's like they're
It's
coming
just
back
weird.
2 months later for a 1 month
Yeah.
booster.
It's not ideal, but in the end, if it's best, and it is
Yeah.
published, this is published, that's what they're recommending. The other thing that they recommend now is that feline leukemia, which we're not talking about today, but feline leukemia be considered a core vaccination through a year of age.
Mm-hmm.
So just so you understand, feline leukemia is only cat-to-cat transmission. And so if you're not going to have your cat around another cat, it's not going to get feline leukemia. Pretty much plain and simple. But their logic is that people don't know what they're doing with their cat in the first year.
Right.
Cats
for
get
sure.
outside, they
Right.
run away. And the cool thing about feline leukemia is so hard for a cat to get after a year of age that they study to even do the studies on the vaccination because they can't get enough cats sick with it to prove the vaccine did or didn't work.
Mm.
So it is almost impossible. It's so hard to infect a cat after a year of age, and certainly after 2 years of age with feline leukemia. So then you might ask, well, why are you even giving it after
Yeah.
that point in time? And it's because they still are being exposed. If you know you have an outdoor cat and it's definitely being exposed to other cats, then it's probably best because we can't know that they're not going to get it. We just know that we can't experimentally infect them with it very
Could be a
easily.
carrier of it?
Yes, they could be.
But isn't
carrier.
that sort of saying that it would be really hard to get it?
It's really hard to get. The bottom line is there's not enough money in any of this to do all the research that would be necessary.
a one every year one, or is it like a every?
It's every year. Feline
Can are they even looking into stretching that out with their recommendations? Because
I
I mean, if it's pretty much impossible to prove they're getting it, like why wouldn't we like with distemper where we're like every 5 years is great, like.
I think it's a good question. I
Yeah.
just don't think there's enough demand. I don't think you're gonna get. And I think like this vaccine here, which we do every 3 years, probably is good for 5. If you had to
Yeah.
guess.
Yeah.
But nobody's gonna do the research. Nobody's gonna put the
Yeah.
money in to prove that. So we're left with every 3. So basically, in the
Task force
upcoming
says
month or
every 2
so,
years.
we very well may change our protocol. I think this change to doing it at 6 months is an easy one. I don't know about the leukemia one. Seems like it's adding another injection. And the issue with injections in cats is that cats that have a certain genetic makeup, any inflammation can potentially stimulate them to have a tumor, which doesn't happen often, but we had Milo recently, young cat that had the big old mass on the side that we euthanized. That was a sarcoma. Now that's not where we didn't vaccinate that cat, I don't think early on, or we didn't. That wasn't an area we would, but that's the type of tumor they get, and they die. It was an ugly tumor.
Remember the one kitty took the leg was taken off.
Yes, they die.
Now this article did say that there is an intranasal.
Mhm.
How come we don't? If I mean I
If it's
imagine that it's
faster.
difficult, but if we want to stop inflammation that a shot can do, why wouldn't we do
I think that's
intranasal?
a good question. I feel like the one thing, put down, because I wanted to look at it, I feel like what I was reading on the intranasal is it also has chlamydia in it, which is not recommended. I feel, I have to go back and check on this, but I think when I was reading about it, because I was like, oh, but then they were like, but it has something else in it which is not recommended to give to the general population.
Oh, that's dumb.
But I have to confirm that. I need to look into that and confirm that.
Yeah,
But
I
there
thought it
was-
was interesting they had a nasal version too.
Yeah.
It says nasal vaccination provides protection especially rapidly 3 to 4 days. Herpes and calicivirus vaccines can be given either nasally or by injection.
Yeah. I will look into that because that may or may not be something that we consider also. Okay, so back to this. How often and how important? I think you guys kind of hopefully have a better idea of why it's important. And then how often, the guidelines behind that. Which are recommended if you're outdoor. Really, the recommendation is the same indoor or outdoor for cats. And for people that say that their cats don't go outdoor, as Sherry just said, the real risk for a lot of these is the fomites. Fomites being your clothing, your hands, your shoes. So everybody thinks they don't have a cat coming home with them, and then they go and they pet, so-so's kitty or the foster kitty, and then they have a cat with them for a year in the house.
What?
Well, they're bringing in the contagion, and it lives in the environment. It can live in the environment for a year.
So for the herpes, it only lives on clothes when things are moist. So any fomite is once it's not moist, then it's
It
not
dries and
contagious.
dies, yeah. So, but the bottom line is that that's why even if your cat doesn't go outdoors, the other thing is that it comes here, and we are a fomite for sure. So they need to be vaccinated just because if they're coming to the vet's office, and when they're going to be coming to the vet's office, even if they've never been to the vet, it's when they're sick. They do not need an upper respiratory infection on top of that. And then crickets. People don't ask about their cat vaccinations. I would argue nobody asks questions, and I don't get anything from breeders saying like, I don't know if it's just a chiller group or it's just lower numbers, but no, I agree. There are no
Multiple
questions.
lives.
But I think at the beginning,
Dogs only have one.
when we started having to require rabies, and we kind of didn't at first, like, that was a little bit, people seem to have more issues than I expected with having to do it, but I think that's quieted down since it's been
I feel like
a long time.
we're getting also to a better place with, I feel like our cat clientele is definitely becoming more proactive.
Yeah.
Or we are just getting clients that, we're just getting the right clients. I think the number of cats we've seen has gone up, significantly. Calicivirus, by the way, comes from calyx, which means cup. It's a cup virus, so I'm guessing the shape of it's probably like the cup. Okay, so next thing we're gonna do real fast, and we'll do one last final thing. Okay, letting people back in.
Do you want me to keep recording?